So if you know something about your measurement reliability, you know that your bunch of items measures something. But what it is measuring? Is it really measuring something that you really want to measure? Or is it measuring something strange? And this is where we have to ask the second question, the question of validity. Why do we need to ask this question of validity? Because error is not only random. There is this random error that is described by classical test theory that affects reliability and that affects each item and each response in a completely random, different way. But there is also what we call systematic error or bias, which is basically an error that affects many items in kind of similar ways. It is not associated with true score, but it is common for different items. For example, if a person says yes to all questions, and this bias can sometimes even lead us to overestimating our reliability. Imagine that I ask you 10 questions about, I don't know, Bandersnatch. Like Bandersnatch is nice, Bandersnatch is awful, Bandersnatch is positive, Bandersnatch is negative, and so on. You will give some kind of answers because you will need to pass this test. You probably don't know what a Bandersnatch is, but some of you will think, okay, maybe Bandersnatch is something nice, and you will evaluate it positively. Others will think maybe it's something awful, and you will tend to evaluate it negatively. Still others will think, okay, maybe I don't know what it is, I will just give average answers to most questions. As a result, your reactions to this would be consistent. You would respond in a consistent manner, and this test can even be reliable, even though it measures nothing. Because a Bandersnatch maybe does not exist for you as a mental object, or it's some kind of mental construction that you make. So this is what Mitchell and Klein would call a semantic artifact. If you have a bunch of questions that are kind of about the same thing, it does not guarantee that people understand what is being asked about and that they understand it in a consistent manner. For example, if you ask them questions about the meaning of life, our research shows that many people don't really understand what it is. So answers are reliable, but it does not mean that they are valid. If we discuss the differences between reliability and validity, we usually use this metaphor of aim or target. Reliability is the question whether your repeated shots hit more or less the same point. Are your results consistent? Do they hit the same point? But the question of validity, is this point really the target that you are trying to hit? Does your measurement really capture what it is trying to capture? And we can see 4 different possibilities. Of course, we all want to have tests that are both reliable and valid, like the one shown on the right at the bottom. But unfortunately, life is more complicated. Of course, if a test is unreliable and invalid or unvalid, it's not even a test. It's just a stupid bunch of questions that don't really measure anything. But a more tricky situation is when your test is valid, but not reliable. Your questions are kind of good, they capture the construct, but Cronbach's alpha is very low. This type of measure you can use in cross-cultural studies, in application to large groups of people, or to evaluate something in large samples. But for individuals, you cannot really make any good conclusions. But even a worse situation is when your test is reliable but not valid. You get consistent estimates of something, and you make some conclusions that are completely misleading because your test is supposed to measure intelligence, and you say, okay, John is less smart, Sally is more smart, but if it measures, in fact, motivation, your conclusions are completely misguided. So an invalid test is not a good idea. How can we measure validity, and how can we prove validity? Unfortunately, the number of validity definitions is almost as large as the number of people who wrote about validity, and some people have calculated something like 120 different types of validity in the literature. So don't get scared if you see something like divergent validity or whatever it is. Just try to understand what a person means. There are two more general approaches that utilize the term validity. Nowadays, when we say construct validity, we mean in general validity, whether my test measures the target construct. And if we try to classify different types of validity evidence, I can simplify that to 3 steps. 3 things that you need to show about your questionnaire when you are developing it, or 3 things that you need to look for if you see a published questionnaire in the literature and you are choosing whether to use it or not. The first type of validity evidence is the evidence of substantive validity. The questions did not come from the sky. They were developed based on some substantive basis, based on some clear definition of a construct, or based on some phenomenological interview data where people described the phenomenon that we are trying to measure, or based on some expert ratings, and experts proposed which tasks are optimal to measure this, or evaluated items and chose the best ones to improve substantive validity, and so on. So this is basically some kind of evidence or some kind of argument that the measurement procedures are good in relation to the construct, are right for this construct, and that they cover the content of this construct sufficiently well. Of course, if we measure something that is very simple and very straightforward, we can just rely on face validity. Especially in positive psychology, when we measure satisfaction with life or happiness, if you have an item that asks people, are you happy? It's clear that it measures happiness. You don't really need to prove it. But sometimes face validity evident to the researcher is not quite evident to people. And people might understand questions in different ways than we thought they would. So we need to conduct some kind of cognitive interviews or focus groups to ensure that people really understand what we are asking them. And we can use some expert procedures to get some expert advice, or to reduce the number of items. Like you've created 100 items, but this questionnaire is too long, and you can ask experts to choose the best items, evaluate how good each item is, and you reduce your set of items. So this substantive validity evidence is the first step. It's mainly theoretical, but also might be empirical. The second step is called structural validity, when we pilot a questionnaire in a sample and we investigate what kind of dimensions do we find in this questionnaire, how many factors are there, does this number of factors and the composition of factors correspond to our theoretical hypothesis. And then for each factor, for items comprising each factor, we also need to evaluate reliability, which can be thought of as part of this structural validity, to find out whether we can gain precise measurements. And that's the reason why we conduct pilot studies, because we need to evaluate the structure and reliability of our questionnaire before choosing whether we want to get more validity evidence and to use it in different samples. And so the first one, substantive validity, the second, structural validity, and the third one, external validity. If your questionnaire is theoretically clear and it's also empirically, it has a clear structure and good reliability, you can ask a question, how does it relate to other constructs, or how does it relate to other types of evidence? And this is called external validity. These other types of evidence can be some kind of criteria based on real life. For example, job performance KPIs rated by bosses, or clinical diagnosis, or does a person get cured or not within a certain amount of time. So some kind of objective criterion or behavioral criterion, which can be gathered at the same time and it will be concurrent validity, or which can be gathered in the future, Like I measured, I apply my test in a sample of job applicants, and then I see their performance over the next 6 months. And this would be a much better evidence of validity if I want to apply this test for selection. And the second type of external validity evidence are convergent and discriminant validity data. Are the scores on my construct associated with different measures of the same construct? And this would be, it says construct here, but it is convergent validity. Basically, if I created a new measure of intelligence, does it correlate with other measures of intelligence? Does it show convergent validity? The correlation is supposed to be strong. And discriminant or divergent validity is that my measure should not correlate with measures of things that should not really confound my measurement. So for example, my measure of intelligence should not really correlate very strongly with motivation. Because if my test measures motivation, it's not a good measure of ability. And in order to evaluate this convergent and discriminant validity, Campbell and Fiske proposed in 1959 an approach called multi-trait, multi-method matrix, where basically you were supposed to take at least 3 different traits and measure each of those traits with at least 3 different methods, like a self-report inventory, a clinical interview, and maybe peer rating. And then based on this matrix of correlations of everything, you would calculate different types of convergent and discriminant validity coefficients. Of course, nowadays people don't do it anymore, because instead of torturing ourselves with correlations, we have a confirmatory factor analysis, and we can just feed this theoretical model to our confirmatory factor analysis software, where we say, okay, we have a hypothesis that we have 3 personality traits that we want to distinguish, like 3 personality disorders here. And each of them is measured with 3 different methods: inventory, clinical interview, and observer rating. And for each of these measurements, we can evaluate the contribution of trait and the contribution of method. Because the contribution of method can be very strong, especially with self-reports. When people self-report, they can evaluate themselves more positively or more negatively or more carefully on all traits. As a result, all self-report questionnaires tend to correlate to some extent just because they are all self-report. But this is method bias. And what we are really looking for is to find out the contribution of latent construct. So this multi-trait, multi-method approach is a very robust approach to construct validation. Unfortunately, in practice, it is also fairly difficult, but maybe for a master's dissertation it might be an overkill, but for a PhD it would be a good idea. So for different kinds of questionnaires, we look for different types of evidence of validity. At least it's substantive validity, structural validity, and external validity. Here it's a slightly different classification. They separate content validity and generalizability. Generalizability is basically that you can apply this questionnaire in different situations and it would still be valid. It would still work in pretty much the same way. So this is also a type of validity evidence that is sometimes necessary. But at least you need those 3: substantive, structural, external. One thing about validity that we need to bear in mind is that validity is not a property of the test itself, but is a property of decisions that we make using this test score in a certain context. So if you have a test with a very low validity coefficient, it can still be useful. How can we quantify validity? Of course, validity is a qualitative characteristic. It's quality of evidence. But if we try to quantify it, and when we say validity coefficient, it's basically a coefficient of correlation between our test and some kind of important criterion, like job performance, for example, or something like that. And already in 1930s, Taylor and Russell, in the personal selection context, discovered that if your validity coefficient of your test, for example, the correlation of your questionnaire with job performance, is only 0.25, we consider it as a weak correlation. But if you have a large number of applicants and you select only a small proportion of those applicants, then the chances that those applicants will be successful are fairly high, 0.67. And if you don't use any test at all, the quality of your selection random guess would be like 0.50. So it is a really good increase in the quality of selection, which can be good for your business, even though it is impossible to say exactly about every single person. Will he or she be successful? But on average, you can be more or less confident. And for some tasks, a test can be good, or we can say that a test is valid for some applications and might not be valid enough for other applications. For example, maybe you have seen this kind of a bit funny paper that we published with my colleagues in this year. And we basically collected data from something like 100,000 individuals who filled out a Big Five questionnaire, and some of them also uploaded their selfies, uploaded their photographs. And we trained a neural network to predict a personality questionnaire score based on the characteristics of those selfies, based on the face, basically. So here you can see average portraits of people high and low in extroversion, and maybe you can see some difference between them. But how strong is validity here? So if we calculate a correlation between the ratings of personality produced by neural network for new people and on their with their test scores, we will see that this correlation is 0.24. So in practice, it translates that if you have a pair of people, one is maybe more extroverted, another one is less extroverted, and if you ask a computer to make a guess, who is more extroverted? A random guess would be correct in 50% of cases. In our case, based on this neural network, the computer would be correct in 60%, or approximately 60% of cases. But the question is it enough? If you want to make a conclusion about an individual, definitely this is probably not enough, because there is a high chance that you are mistaken. So this is not good for personality assessment. But if you want to apply it at a large scale, when the cost of a wrong decision is very low and the benefit of correct decision is substantial, for example, to target advertisements. Maybe if extroverts prefer bright colors and introverts prefer softer colors, you can just have two types of advertisements and target them based on extroversion and introversion. Even though correct guess will be only slightly above 50%, still this percentage difference can bring substantial revenue to your company. Or if you match pairs in a dyadic interaction setting or dating apps and so on. So even if validity is not very high, just think of in what context it might be useful. Now, a little bit on threats to validity of our questionnaires and how we can actually combat those threats. Obviously, the first problem is low reliability. And some authors say that low reliability kind of translates to low validity. This I might not quite agree with that, but obviously random error is really bad for our measurement, and we can apply strategies to reduce it. Also, systematic error. There are some well-known types of systematic error, and there are well-known strategies of reducing them. But of course, also your validity can be threatened by wrong choice of a questionnaire or wrong administration if the time limit is not observed, or people fill an IQ test with interruptions or with distractions. The scores will not reflect their true abilities. Or your interpretations may be sometimes mistaken if you are trying to get some information from tests that it does not allow you to get. So just a few words on how can we reduce our error and how can we improve our validity. First of all, random error. In order to reduce random error, you need to make good items. What are good items? First of all, your items are clear and readable. They are easy to understand for a person without a university degree. We used sometimes exotic words in our items, and those items did not really work. So an item should be very clear and simple. Sometimes even in well-known measures, like for example the positive and negative affect schedule, which lists 20 different properties of affect, there is one jittery which native English speakers tend to understand, but non-native speakers don't really understand, and that item is not good for cross-cultural comparisons. An item should be unambiguous. It should only contain one idea. Of course, sometimes it's necessary to make exceptions, but usually one idea per item. A bad item. I like cats because they are fluffy. If I say yes, okay, I like cats because they're fluffy. But if I say no, does it mean I don't like cats? Or I don't like fluffy cats? Or I like cats but not because they're fluffy, for some other reason. So this is an ambiguous item. Don't use items like this. It's a double-barreled item. Use I like cats, I like fluffy cats, and so on. An item should be equally applicable to people from different age, gender, and ethnic groups. An item should also be specific rather than very abstract, vague, and general. I like sports. It's a bad item. Does a person like playing football, or does a person like watching football? Or maybe they like playing chess, also a sport, but a very different one with different consequences. So better, I play football at least every month. That would be, or I enjoy playing football, a much more specific item. Also, a good item should not provoke the same answer in most respondents. This is called floor or ceiling effects. I am a good person. Well, most people will say probably yes. So try to avoid answers which provoke universal, try to avoid questions which provoke universal agreement or disagreement. Usually the most useful items are those where on average people give an answer around the middle of scale. Of course, again, exceptions exist, but not always. And also in 1950s and 60s, people used to say that an item should not be too obvious in terms of what it measures. Like a person should not be able to guess just by looking at the questions what the questionnaire is about. But now we know that in many cases this is impossible. In many cases we need face validity, and there is no way to ask people a question about something which they're supposed to directly self-report. So this is not a big issue. Unless you want to conceal the true intent of your measurement from people, and then you need to really think how to formulate questions. Also, people used to say that questionnaires should not be formulated in subjective relative terms. Like, I often have nightmares. If a person says yes, maybe he or she has them every night, or maybe he or she has them once a month. So often is very vague. But nowadays we say, okay, but maybe you're interested in how important nightmares are. So if a person says, I often have nightmares, it means that they consider that they have them often and they are troubled by this, regardless of whether they have them once a week or once a month. So sometimes it's possible to use formulations like this. But if you want a clinical test or a more objective test, you would probably ask like, I have nightmares at least once a week. And we also need to pay attention to the order and the number of items, because people get tired, they can start giving random answers after a certain point. And also, if you have several items that are very similar in sequence, people will stop reading the following ones if they see it's similar to the previous one. And the answers will also be lower quality. So it's best to mix items that measure different constructs. Like, for example, in the same questionnaire, if you have 5 different traits, usually you balance items like 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and so on, so that items that measure the same trait never follow one another. And these are some simple strategies to reduce random error. What about systematic error or bias. There are some well-known types of bias. Midpoint responding, when people tend to give average answer to all questions. This often happens when people are afraid to give you a honest answer because they don't really know how the results of the test will be used. An opposite version, extreme responding. On a 7-point scale, people always give you 1, 7, 1, 7, 1, 7. These can be due to personality characteristics. If you give a questionnaire to Donald Trump, you can be confident that he will give always 7. But more often, this is also due to situational factors. People don't have time to really evaluate their answers. As a result, they give very approximate answers that are often on the ends of the scale. If you ask people to complete a bunch of questionnaires under a time pressure, extreme responding will be boosted, and it will screw up your data. Acquiescence, tendency to say yes, also called yes-saying. Regardless of what the questions are, some people are more likely to say yes to all of them. This is associated to some extent with education, but mostly is associated with culture. There are cultures where it's not polite to say no to people. Central Asia, East Asia, if you have data from those cultures, you can be confident that responses will be biased by acquiescence. That's why in cross-cultural studies, people devise special scales to measure acquiescence, comprised by forward-scored and reverse-scored items in equal amount to make sure that you can actually capture this acquiescence as a shift from the middle. And finally, some people may give you random rubbish answers. Last time we discussed a little about it. And there is also a common type of systematic bias, which is called social desirability. What is social desirability? Basically, it's a tendency to present yourself in a very positive light when you answer questionnaires. In the 1930s, people would think that researchers would think that people always fake their answers, and they would include so-called lie scales into their questionnaires, with questions like, I'm a honest person, I always help when I'm asked for help, and so on. And they assumed that if you answer yes to all those questions, it's very unlikely that this is true. So probably you are lying. And based on this, they would recommend to exclude those protocols from data processing. But nowadays, we know that the reality is not so simple. There are different types of social desirability. It can be conscious, where people lie or manage their impressions about them consciously. But it can also be unconscious. It can be self-deception, when I believe that I'm slightly better than I really am. And this self-deception is also useful psychologically because it helps us achieve in some situations. And also motivation can be different. I can play nice, I follow always the rules, I always help others, or I can play cool. I can say I have everything under control, I never forget things, and depending on whether I'm being hired for a position of teacher or manager, I will show different types of this motivational bias. So it is a bit tricky. But the good news is also that in 1990s, researchers discovered that actually people only show social desirability under high demand conditions. If they are motivated to present themselves in a certain way, they might do it. But if these are just anonymous volunteers, the results of this survey don't affect them in any way, you should not worry about social desirability. And even if you administer a questionnaire in a selection context, and you try to exclude people high in social desirability, this might not always improve your validity. Of course, you might exclude people who lie and who create a very positive image. But you might also exclude people who are motivated for approval. And this motivation for approval would also be helpful for them to perform better in their jobs. So as a result, if you try to exclude people who kind of you think are lying, you might actually exclude people who are actually nice and who want to be nice in questionnaires and in real life. So social desirability is very tricky. Other types of systematic bias are a little bit more simple. So if you have people with a tendency to say yes to all the questions, the best strategy is to balance forward scored and reverse coded items. I am a happy person, I am an unhappy person. If a quiescence shifts an answer, this shift will cancel each other out because every second item is reverse scored. If you are worried about extreme responding, it will be bad if you have a 7-point scale. But if you have like a 4-point scale, the consequences will be much weaker. So you can reduce the number of answer options. With 2 answer options, you don't have extreme responding, and you don't have midpoint responding. To eliminate midpoint responding, you can make a scale with 4 points or 6 points instead of like 5. For random responding, you can use different strategies that we discussed last time during online studies, like using self-evident items or statistical control. And for social desirability and other types of bias, you can also use ipsative measures. Basically, ipsative measure is when you create a pair of stimuli with equal social desirability. Instead of trying to evaluate statements like I'm a responsible person and I'm a polite person, you ask people which is more like you, responsible or polite? And they give you an answer on a scale which shows which of those descriptions is more applicable to them. But unfortunately, psychometrically, this is a huge pain. Classical test theory is not applicable to this kind of data, and even some IRT models are not applicable. So it's very hard to actually work with it psychometrically. And for social desirability, you can simply try to prevent it by giving people true information about the aims of the study and how the information will be used, and so on. So this was a little bit about validity and systematic error and how we can control it. I hope that you now have an idea that what you need are actually 3 types of validity evidence: substantive validity, structural validity, and external validity. And if you develop your own questionnaire, it would be a good idea to think about your response scale, think about your answer options, think about reverse coded items if you are going to administer it in different cultures especially. And of course, think about item formulations. They need to be clear and understandable, and even in translation, they should be clear and understandable. But we will also discuss this a little bit later.